Nursing has been good to us. These words were shared with a group of us at the University of Pennsylvania many years ago by then Dean Claire Fagan, and we have remembered those words forever and really lived them out. She was one of my sheroes who ultimately became president of Penn, the first woman to head an Ivy League university, and a real force of nature. Nursing has been good to us, and I can attest that it has been good to me for more than 50 years. I tell pretty much anyone, especially students, that I would choose nursing again tomorrow. I've had such rich experiences and made countless friends over the years. I really feel I've been able to make a difference. You have invested in your career and are graduating in what has rightly been called a year like no other. Interestingly, although I graduated many years ago, decades, I have a bit of an inkling as to what you've gone through. Because you see, I graduated from the University of Wisconsin-Madison in 1968, which is the year that has been most compared to this one. So there are very many similarities. We had a divisive presidential election, racial unrest, demonstrations, anger with the police, tear gas, and the National Guard as we went to class. You have also had COVID in the mix, but it's interesting to note that the name coronavirus first appeared in a research paper in 1968. And while nursing has been good to us, what we've seen this year is that nurses have been good for the public's health, essential, in fact. This year, it's been heartbreaking and humbling to see what nurses and all frontline caregivers have endured, and the tenacity, heroism, compassion, resilience they've shown. One of our nursing leaders, Donna Deers, called us tough, canny, powerful, autonomous, and heroic. We've known this all along, but sometimes the public hasn't. One positive thing about this year, ironically named the Year of the Nurse before COVID and the Year of the Nurse and Midwife before COVID struck, is the visibility that nurses have achieved. We've always been known as caring, compassionate angels of mercy, but you all know that it's so much more than that. And now the public has seen that too, the caring and the competence day after day. I actually like the words that a Boston cab driver used to describe us. Caring, shrewd, a little bit crazy. And we are all these things. We understand the human condition through our nursing lens. We're able to connect with people when they're challenged. We're able to connect with people in their most vulnerable times. We've faced extremely sad moments and joy. We've sometimes had to inflict pain to help people feel better. We've ushered life in and we're there as it ended. We've come up with incredibly creative approaches to seemingly intractable problems that society faces. So today, I want to congratulate you on being caring, shrewd, a little bit crazy, and wise, for deciding to become a nurse or progressing in your career, for doing so against all odds, and for attending this great school of nursing. As you all likely know, but maybe your friends and family don't, our school was the very first school of nursing in the country that was expressly launched within a university, and that continues to this day. That was 1909, so we're not actually continuing, we're leading the way. Extraordinary graduates, leaders at all levels, innovators. At this school, researchers are conducting research on COVID-19 to help us understand how to prevent the virus from spreading. Faculty are tackling the challenges of ensuring that mental health resources are available in rural areas. Our school has one of the first director of planetary health positions in the country, if not the world, and our students are working to address climate change, health inequities, family stress, a number of other issues that confound society. Today we celebrate graduates from several distinctive programs, some of which are again among the first in the country. Some of you will receive a PhD or the Doctor of Nursing Practice. A number of you will receive a professional master's degree. Our school was among the first, again, to offer it in this particular way. And several of you will receive a degree or certificate through 2 groundbreaking programs in integrative health, the Master of Arts in Integrative Health and Wellbeing Coaching, and the Post-Baccalaureate Certificate in Integrative Therapies and Healing Practices. All of you will make a difference. We are confident. So, congratulations to you all. Regardless of our age or experience, when we graduated or where we choose to work, we are all nurses, and you are entering or progressing in this profession that will ask so much of you and give you so much in return. I'd like to close with my favorite reflection on our shared profession. Nursing puts us in touch with being human. Without even asking, we are invited into the inner spaces of other people's existence. For where there is loneliness, suffering, the tolerable pain of cure, or the solitary pain of permanent change, there is a need for the kind of human service we call nursing. Thanks for letting me be part of this most important day in your lives and your careers.